Welcome, everyone. We are excited to have you today for the Brown Bag Science in Webinar Series. Brown Bag in Science webinar series. Sorry about that. It's Friday. The goal of the webinar series is to familiarize our ACSM students with the breadth of science that ACSM members conduct. So today we're really pleased to welcome Dr. Jeff Konin as our presenter. I'll tell you more about Jeff in just a minute. I want to start with a few housekeeping items. If you have any trouble hearing or seeing the webinar, please hang up and join again. It's most likely a problem with your internet connection. Our presenter today will talk for about 30 minutes, and then we will have time for question and answers. If you have questions throughout the presentation, please type them into the GoToWebinar question area on your screen. If you purchased a CEC for today's webinar, you need to watch the entire webinar to receive your CEC. The 1 credit will be applied to your ACSM account within 2 weeks. When the credit is accessible, an email will be sent to viewers with instructions on how to access the CEC documentation. Now, I'd like to tell you more about Dr. Konin. Jeff earned a bachelor's degree in health and physical education from Eastern Connecticut State University, where he was the first graduate of the school to become a certified athletic trainer, and he was presented with an athletic department leadership award upon graduation. He has 2 master's degrees, one in athletic training and sports medicine education from the University of Virginia in Charlottesville, and the other from the University of Delaware with a specialization in physical therapy. In 2004, Dr. Konin completed his Ph.D. in physical therapy from Nova Southeastern University in Fort Lauderdale, Florida. Currently, Dr. Jeff Konin is a clinical professor at Florida International University in Miami, where he directs the Doctor of Athletic Training Program and the Global Initiative for Cannabinoid Research and Education. Dr. Konin is a certified athletic trainer and licensed physical therapist and a fellow of both ACSM and the National Athletic Training Association. He currently serves as chair of FNATA's Cannabis Education Task Force. Wow, I got through that. Okay, it's Friday and we are excited to be here, so I'm going to kick it over to Dr. Konin at this point for his presentation, and we will join you all again for questions and answers later. So Dr. Konin, take it away.
Thank you for that introduction, and what a great opportunity to spend this Friday afternoon with everybody. I appreciate the opportunity that ACSM has given me to talk about cannabis and the current trends of cannabis, particularly as it relates to exercise science and sports medicine. So I have a couple of goals this afternoon. First is to talk about the reasons why there's such this increased recent interest in cannabis use in general, recognize the impact cannabis can have on our future populations that we all work with, and then to provide an overview of some of the current research that exists and the research that we're doing at FIU. And of course, at the end, we'll save some time for Q&A. I do need to just briefly disclose I am the president and founder of Ph.D. 420, which is a non-for-profit organization here in Florida that does cannabis research and education. I also receive funding support from SunMed and Valid Care, and I'm a conference director for the first of its kind Cannabis and Sports Conference next June in Orlando. The global initiative for cannabinoid research and education is something that we've undertaken at FIU as a result of this recent boom of cannabis use in sports and, quite frankly, in all patient populations. And I just want to give a quick shout out to all of the folks within our research lab itself. These are our doctoral athletic training students that you see here, and then also some of the faculty and administrative supporters, as well as some of my colleagues that work with me at Ph.D. 420. I don't do all this by myself. It takes a large team to put together the initiatives that we have for research and education. So where do we start? We're not going to talk a lot about the guy on the left. That's not me. I'm the guy on the right. But, you know, I, like most of you, a couple of years ago, wondered what's going on. And certainly cannabis wasn't even in my vocabulary. And so the more I started learning about what's happening out there, the states that were a little bit more progressive than others, and what people were saying, from our neighbors to quietly some of our athletes and patients that we work with, that it led me down this pathway to do my due diligence as an educator and a researcher to find out if there's something to this, and if there is, exactly what it is and how it works, and then what concerns really do still exist. And so as I look at this, as of just recently, you can see the map of the United States, 37 states and the District of Columbia currently approve what we call medical or medicinal cannabis, and 19 states in DC approve what some people refer to as recreational. The more appropriate term is adult use cannabis. And so as this change legislatively sweeps across the country, we truly owe it to ourselves to understand the role cannabis has. And so what I've seen is a couple of options. For example, if somebody asked you, what is this product that I have in my hand here? You can either say, I have absolutely no idea. And that's not a good answer, because you're their trusted, healthcare provider, fitness instructor, exercise physiologist, physician, and they look to you for these answers. You could give false information and say, oh my God, whatever's in your hand must be illegal. That's cannabis. You shouldn't have that. And perhaps that's not the right answer. Perhaps it is legal, and maybe it does have a benefit. Or you can say, you know what, let me take a look at that. I'm a little bit familiar right now with what's happening with cannabis. Does this have a QR code? What are the ingredients in here? What are you taking it for, and what are your symptoms? And so there's a vast difference between each of those three responses. And I think everybody would agree that it's the latter of the three that's probably the best answer, as each of you educate yourself more and more. Now, I want to tell you that I understand on this webinar today, on this Friday afternoon, there's over 500 people. So we're going to just do a cursory overview in the 30 minutes that we have of some of the hot topics in cannabis. And then we probably won't be able to answer everybody's questions. So at the end, on the final slide, I'll give you my contact information. You're more than happy to reach out to me if you want to set up some type of company, or if you have a class or a clinic you're in, you want to set up another presentation that has more specific information towards what your interests are. I'm happy to do so. And I'll also send you a copy of the slides PDF if you reach out to me. So you've seen these things before, right? Where doctors who get angry at the patients that come in because they did a Google search and they think they know everything there is to know about medicine. Well, you're seeing the reverse right now, actually. The patients are doing the same thing, because very few people in medicine are actually learning about cannabis and the importance of it, good, bad, and indifferent. And so therefore, patients who have had conditions actually improve by taking something cannabis related are seeking support of their medical providers as well to learn and help them better understand why something might be working. And this is quite frankly what's happening. We work as healthcare providers in a world of design, right? We want evidence-based, we want nice, good research to be done, clinical trials, and the patients and the athletes that we're working with are not. They just want an outcome the quickest way possible, and they're finding relief. And this is one of the rare cases where science is lagging behind outcomes. Patients are reporting improvements, legislators are changing laws, and yet we don't have all the science to support or understand why this is happening. What's happening in sports? Well, I think that while many people here may not be working in pro sports or the Olympics or even at Division I colleges, for example, what happens at those levels drives what happens ultimately in the general public. And so here you can see over the last couple of years, for example, the NCAA has loosened its policy on cannabis, particularly THC/marijuana, where they've decreased a suspension for a positive test from what used to be an entire year to now 50% of a season. And they've increased the sensitivity level over 2.5-fold for a positive test. So there is an indirect message being sent here of a slower, if you will, and I'm not speaking on behalf of NCAA, but there is a slower form of acceptance here when you look at how these rules changed. From a standpoint of the World Health Organization and what we're seeing now with World Anti-Doping in 2018, CBD, a portion of cannabis, has actually been permitted under and removed from their prohibited list. And also, there's now discussions at the WADA level to take a look at cannabis as a whole and the future that it plays, whether it be a banned substance or not. We should find out something along these lines, I think, in the next couple of months, hopefully. The NFL, as many of you have heard about, is now undergoing some studies. They've funded some research to identify if different forms of cannabinoids, such as CBD, which is also known as cannabidiol, have an impact actually with respect to pain reduction or as a management alternative to opioids. And you can see here in some of the quotes that the NFL is saying perhaps there is an alternative, and we are going to explore this through scientific funding. You're also seeing now a number of former players, and not just in the NFL, but former players in all sports coming out when their careers are over, saying, yes, quite frankly, I resorted to using some of these products for my pain management, my inflammatory reductions, things of that nature. All ends of one. Major League Baseball. In 2019, December of 2019, literally almost 2 years ago to today, came out with a memo that said that natural cannabinoids, CBD, THC, will be removed from the program's list of drugs of abuse. So no longer testing and treating cannabis as a drug of abuse, and quite honestly, with respect to that, a performance enhancer. So where is the research? Well, it's really interesting. If you do a PubMed search and you simply type in the word cannabis, you will find over 27,000 published peer-reviewed manuscripts. So you say, well, what does that mean if you just said we don't have the research to support this? Well, first of all, most of this was not done on humans. Most of this was done on rats and mice, or on pharmacokinetics itself that did not provide to be translational into the human population. And so these papers are typically not in the journals that you or I would read. They're in journals of chemistry. They're in journals of psychiatric medicine, opioid overuse. And if you look to the chart on the left, you'll see the trend in the spike of the publications. The majority of these publications have actually started to come into light in the last 3 to 5 years only. A systematic review in 2020 by Dr. et al. Showed that 23+% of athletes surveyed reported using cannabis within the last 12 months. Now, these are university athletes who technically any form of cannabis is currently banned from use. Yet 23+% said they were still using. More importantly is we have found when we do surveys that require self-reporting of such use, typically the results are underreported. So there's perhaps a likelihood that this number is even higher. So why are so many individuals using this? A, if it's banned, and B, there's a cost to it. So are they truly finding relief? Is this relief actual scientific relief, or is it placebo or perception? So let's just do a little bit of terminology here and understand that inside our body, we actually have natural cannabinoids that the body produces. These are called endocannabinoids. What we're going to spend most of our time today talking about are phytocannabinoids. These are the actual components of the plant itself. And within the plant, the phytocannabinoids contains, depending on who you read, 100, 140 or so various different cannabinoids. You are probably most familiar with CBD and THC. And so we'll spend a little bit of time talking about how these two perhaps interact in various studies that we have seen relative to pain, inflammation, performance, etc. These two, being the most common, have a significant difference though. The primary difference is that CBD does not have a psychoactive component to it, such as that high, that euphoria. Whereas THC, specifically referred to THC delta 9, and this is important because there are other forms of THC, but the THC delta 9, which is what most of us typically commonly refer to, has that euphoric sense. And it's important to understand that these can be separated from the plant. So yes, it is possible that somebody can have a product that's CBD, typically referred to as CBD isolate, and it does not have, or it has only a minimal amount of THC in it because the CBD was pulled out of it. There are products that have THC by itself, and there are products that combine a number of the different cannabinoids. Here's just a quick example by name and terminology of some of the other types of cannabinoids that do exist, and some of the proposed benefits that again have been reported anecdotally in small case studies of what each of these cannabinoids are believed to do in the human body. All of this is part of what we now know of what is called the endocannabinoid system, or ECS. And some of you are saying, I've never heard of this. I know of the nervous system, cardiovascular system. How come I've never heard of this? How come this wasn't taught to me in school when I took anatomy and physiology, for example? Well, there's probably a number of reasons. First and foremost being that it really wasn't discovered until late 80s and early 90s and put in print about the understanding of how this system actually works. Since then, there are actually a fair amount of excellent manuscripts that provide a good overview, including textbooks of an overview of how this system works. And the system works basically on receptors within the body where the endocannabinoids naturally bind to. And the majority of the receptors are called CD1 or CD2, and they are located ironically throughout the body. Now, why is this different and unique? Because in most systems in the body, the receptors are just simply attached straight to that system itself. Here, these receptors are essentially, they're in muscle tissue, they're in organ tissue, they're throughout the body. And this is the reason why you will come across people who say, you know what? I use CBD and it helped me with Crohn's, and I used it and it helped me with my anxiety. Why are so many different individuals receiving symptom relief from similar products when they have completely different conditions? Is because of the location of the receptors throughout their body. Now, another reason why you don't know about this is it's just simply not taught in school. And I'll show you a little bit later how it's taught in school, where it can be taught in school. And most of our faculty nowadays are not familiar with this or haven't accepted the fact that there is an endocannabinoid system and that it's worth sharing with students so you have a good understanding of how this is proposed to work. Furthermore, it's been identified that when the body has a deficiency of these endocannabinoids, so they're not producing enough, or the endocannabinoids in the body are not binding to the receptors. And by the way, this should sound a little similar to you like an endocrine system relative to insulin and diabetes, blood sugars, etc. It works in a very similar manner. So when there's not enough endocannabinoid production, when there's not a binding of this appropriately, this theory is that we have what's called the endocannabinoid deficiency or clinical endocannabinoid deficiency. And it's been explained by symptoms that have found relief, such as migraines and fibromyalgia and others. In fact, these are conditions that really we define by a clump of signs and symptoms, and quite frankly, we haven't treated all that well over the course of time. Additionally, there's some really good papers out there that talk about the role of these phytocannabinoids as a neuroprotective agent. In particular, CBD has been shown to assist as a neuroprotective agent and as an anti-inflammatory beneficial product. Now, what's really interesting is if you go back and look at the US government page, particularly Health and Human Services, you will find that in 2003, the first and only existing patent, to my knowledge, actually was found by the government itself for the use of CBD as an antioxidant and a neuroprotective agent. And so this is of great interest to me, and this is actually how I started going down the road of studying cannabinoids because I was posed with a question relative to concussion management, and could something like CBD or, quite frankly, even THC assist either prophylactically with minimizing the severity of symptoms following an acute concussion, or in treating a post-concussion that has residual anxiety, migraines, difficulty falling asleep, and symptoms like that that are proposed to benefit from various forms of cannabinoids. And so here's an example where you know that associated with a sport concussion, there are neural elements involved. And so if in fact, for example, CBD plays a role as a neuroprotective agent, what role could it, if any, play relative to the future of our management of sport concussion? So let me walk you through just a couple of other areas of proposed benefits of symptomatic relief that the literature has shown. We'll start with anxiety. In the literature, the search that I showed you from PubMed, there are over 1,800 peer-reviewed articles that speak to cannabinoids and anxiety. And there's a strong volume of evidence that shows low doses of THC, various doses of CBD, sometimes combinations, can produce a reduction in anxiety, a feeling of calmness or relaxation, particularly acutely. However, it's important to note, like with all of the things we study, that there's an interesting curve here in the sense that too much THC can actually do the opposite and reverse and increase one's anxiety. So this is an area of future research. I think you will see a lot of individuals with great interest relative to anxiety because of its importance and relationship to sleep and ultimately performance. Pain is another area that this has been significantly studied in. There's over 2,000 peer-reviewed manuscripts that look at the role of pain and cannabinoids. And remember, in general, a lot of what we first learned in pain goes back to the early theories of Melzack and Wall and how we quote unquote opened the gate or closed the gate. And some of the theories of how the cannabinoids work and either bind to the receptors or and serve in a facilitatory manner, or bind to receptors and serve as an inhibitory manner to the pain receptors, are very similar in the proposed mechanisms here. And we're seeing a larger use of cannabinoids relative to pain relief in anecdotal information that's passed on to us. And I think you're going to see more and more of this in the future. There's a decent amount of literature that is showing that THC can actually be used not only as an alternative, but to assist with removing opioid addictions from individuals and at least minimizing the rate of recurrence of the use of opioids. And so again, this will be another area, I think, of great interest. The strongest paper that I've read through here was a systematic review. It was published in 2017. It looked at 43 random controlled trials. It did not show clinically significant benefits for pain reduction. One of the things that I think is really, really important here to understand, again, we lack in evidence, but we need to listen to the patients, because the patients are truly telling us to a person that N of 1 that they are getting relief. They are not using other forms of medications. And so we really just owe it to ourselves to study this and really understand if there's a mechanism and if this is truly happening from a clinical perspective. Recovery is important nowadays. It's certainly one of the more focused on areas of what many of us do. And there's not a lot of strong evidence in this area. There are over 400 peer-reviewed manuscripts that mention the word recovery in them, but for the most part, this is indirect from some of the other studies that have looked at pain and inflammation responses. So I think that ultimately down the road, we'll see some more work on this. But it's important to understand too, it's very difficult to study individuals who are actively playing a sport and have them undergo a clinical study. It's difficult to get buy-in from everything from your institutional review board to the coaches and the players themselves sometimes. So this might take a little longer for us to have a better understanding relative to recovery. Strength and endurance is one area that I'll say is really important to understand. That there's only, I found 22 peer-reviewed manuscripts here, but this is where we lack the most information and particularly any evidence that there is an improvement. In fact, depending on the dosage that one uses, particularly related to THC, you'll actually find that there are adverse relationships to the cardiovascular system. And so this area may need to be studied more to further support the adverse relationships and help us better understand dosing and also the application, which also plays a critical role. So what is the manner in which the cannabinoid is being taken into the body? Movement and reaction is very interesting, and what the literature shows right now is, as you would probably expect, no change in movement and reaction with non-THC based products, but when THC is used, there is a decrease in coordination, a decrease in reaction time, judgment is impaired, learning and memory are impaired with THC primarily. And a lot of the better studies here are not related to actually sport and exercise performance, but with respect to driving. And with driving, you have seen impaired reactions when critical tasks have been asked to do. And this is probably not a surprise to anybody. Now, just a brief overview of what we're doing at FIU. We have over half a dozen live studies going on right now. We are looking at what I've underlined here on the various different studies, ranging from sleep to sleep and performance, anxiety, sleep and pain. We're looking at a perception of learning and anxiety. We're looking at muscle soreness, and we're looking at the various cannabinoids from CBD to CBN primarily, also using CBG, different dosages, what we call a low dose versus a high dose, and that's up for debate. Our term of low dose being in the 10 to 15 or so milligram range, where high is closer to 25 or 75. And I've come across people in the industry that talk about a couple of 100 milligrams being a high dose. And so dosing is one of the things that we really don't have a good handle on, and we need to learn a lot more about this. Our studies include general university student populations, professional athletes, healthcare professionals, and others, including those that play club sports, those are involved in CrossFit. We're also doing pharmacokinetic, we call PK study, looking at the bioavailability of what's called an oral nanoemulsion, so a different type of a compound of the CBD itself. And what we're really looking at here is how the cannabinoid actually is digested within the body. Is it actually effective? Are we finding it in the bloodstream? Most of these cannabinoids are lipid soluble, so they go through the liver for a liver bypass first. That, for example, is why if you've taken a gummy and it has THC in it and you're thinking 20 to 30 minutes later, you don't feel anything, but about 2 hours or 2.5 hours later, you start to feel the effects of the THC. It's undergone that liver bypass. It takes a little bit longer to digest in the body. There are other products that are water soluble, and that's where the industry is actually looking at right now, so that there's more of a quick acting, which is what people want. You know, they want to take something, put it on or in their body and have that effect right away. So they're looking at water soluble products. So the pharmacokinetics and the bioavailabilities are really where the top areas are right now of research, in addition to dosage itself and verification of symptom improvements. Now, we don't have enough time to talk a lot about this, but you know, there's some proposed benefits for various forms of cannabis. There's also a number of other areas where there are some risks and concerns. The literature identifies various conditions from psychosis to chronic vomiting, and what we don't really understand well is the interactions of any cannabinoid with existing medications that one might be taking as well. There's an excellent paper here that I've highlighted in red, Balachandran and others published and looked at the proposed interactions chemically of what happens with more of the common medications and how CBD would interact with that. But we need to have a better understanding of when we combine any form of cannabis, even with alcohol, for example, what that's doing to an individual, as opposed to just looking at a form of a cannabinoid in and of itself. Unfortunately, what we've typically done now, because we don't understand dosage well enough and we don't understand interactions with other medications well enough, is the prescription or the recommendation for what's being used is a dosage of quote unquote start low and then go slow, and then let's see how we tolerate it. This just is a slide that gives you an overview of some of the examples of the types of things that you'd want to think about. And so again, the problem here is we also don't have human clinical trials to take a look at this. And so this is another area why pharmaceutical companies are concerned, for example, with the states that have passed medical marijuana laws, because they truly have passed these laws legislatively. Modern technology, and I'm going to try to pick up where I left off and keep us on time. I apologize for that. We lost power. Okay, so just very briefly here, just to mention that these are a number of surveys that were done. My group performing a couple of these that looked at what's being taught in the curriculums throughout the United States and North America, ranging from healthcare professions to medical schools to pharmacy schools. And you can see that the numbers are really, really low. But what's of greatest interest is the third bullet point down. A majority of the students actually believe it's important and want to learn more about cannabis in their curriculums. And so med schools are starting to slowly increase, even though the numbers are still pretty low. Pharmacy's probably leading the way, and we're doing our best to help educate the educators so that they can start to teach this. And whether it's athletic training, physical therapy, exercise science, it really doesn't matter. All of us have an obligation to answer questions from those that rely on us for such information. Where can you teach us in the curriculum? This is the coolest part, actually. So everything from anatomy and physiology, which we talked about, the pathology, we've talked about the endocannabinoid deficiency, of course, pharmacological interventions. There's a whole slew of legal and ethical issues. There's a lot of ways to apply this in your clinical courses with your clinical instructors and experiences. It's definitely a public health issue. You'll see that there's a tie-in to society right now and some of the cultural competence issues that we look at. And then I think in general, you can really learn an awful lot in your clinical settings, more so than your classroom, because your patients will confide in you on what they're using, if they're using any cannabis-based product. So to sort of tie this up, areas of future research, obviously anything related to potential efficacy is critical. The risk benefit and the potential interactions and harmful effects are something we need to understand better. Dosing is something we don't know enough about, as well as the mode of application. How do we measure if we're going to continue to identify deficiencies in a system, or we're going to drug test for sport? How to identify blood or urinalysis levels within reason that are cost effective. Also, important to understand how intoxication is different from actual impairment, right? So you could have, for example, THC in your system 10 days after using it, but it's not likely you could actually be acutely impaired. And there are workplace issues as well as performance issues related to that. How to better understand what cannabinoids can, if possibly, be used for certain populations of individuals, pediatrics versus geriatrics, and illness-specific conditions. And then we've already talked about how they relate to performance and symptom management. And there's so much more. So it's just a really exciting area to get involved with, because there's so much we don't know, and there's so many great opportunities to study. So as I promised, and again, I apologize for getting kicked off the system for a few minutes there, but this is our information if you want to see what we're doing at FIU. That's the link to our global initiative for cannabinoid research and education. This is my email, jkonin@fiu.edu, and I'm going to go out on a crazy limb here, I've been told, but if you are interested, I know you'll have availability to the video of this webinar, but if you would like a copy of my PDF slides and you agree that they're copyrighted and you won't use them without express written consent, simply email me, request a copy of the PDF slides. I'll shoot an email back to you with them. And then if you want to follow what I'm doing relative to cannabis topics, you can feel free to follow me on Twitter @Dr. Konin. So I will stop there. I really am excited to have some questions and see what's on your all mind and see if I can answer any of those questions and provide some more guidance. And then again, anyone who really wants to dive into any of these areas deeper, more specifically, reach out to me, let me know, and we can certainly set up various either virtual or even live presentations depending on where you're located and what your goals are. So I'm going to stop there and turn it over to Lynette and August.
All right, can you hear me, Jeff?
I can hear you.
All right, that's great. Why don't you go ahead and turn your camera on if you would like to. We did have one request, if you could quickly go over the drug interaction slide a little bit. I think that might have been about the time where technical difficulties started, and a few people were asking if you could just go back to the drug interaction slide again.
Okay, I'm going to try to do that. Do you see the slides now?
Have access. Why do you have access? We see you.
Do you see slides?
Yeah.
Okay, so that's not what we want to see. Okay, here we go. So you want to see monitor 2, and you want to see this slide?
Yes, that's great. Thanks.
Sure. So basically, what we really don't understand is, you know, if you've been sitting home on TV and you're watching a commercial for a new drug, and the new drug, they say, check with your doctor first before you take this drug, because if you're also taking X, Y, and Z, this could interact with those. And if you have this condition or that condition, then you don't want to take this medication as well. So that's the concern that we have with any form of cannabis, whether it be THC or whether it be CBD. And the reason is that as it interacts with the body's systems, it then interferes with whatever drug you're currently taking that could interact with your body's systems. So if you're taking metformin, for example, for type 2 diabetes, you need to understand what will be the impact of this if I take CBD. Will that facilitate the metformin? Will that inhibit the metformin from working? And these are the types of questions that, honestly, our patients and our athletes need to rely on our physicians and our pharmacists for these answers. The challenge here is that, to be honest, we don't have enough physicians that know this. They've not studied this. They maybe aren't involved in it in any way, shape, or form. They maybe don't support any form of cannabis. But this is really one of the main areas that we need to learn more about. And it's not good enough for us to just have a really good peer-reviewed manuscript that proposes what could happen, or, for example, we have a written document that we all refer to that sits on our desktop. We really need qualified medical experts to help provide the answers to this. But before that even comes about, we need to develop the answers, and that's in clinical trials.
Okay, so here's a question asking about if there's been any research on how the neuroprotective benefits of exercise may or may not interact or overlap with the possible neuroprotective benefits of cannabinoids.
That's a great question. And I'll be honest with you, I don't know the answer to that. I would probably end up doing a PubMed search just like you. That particular area is not one area that I'm heavily involved with studying right now, so I can't answer that for you.
Okay, here's another one. Is there any evidence for CBD or THC helping alleviate or prevent migraine symptoms?
So I don't think there's evidence in preventing. There's certainly evidence, both published and significant amount anecdotal from patient reports, that there's symptom relief from migraines from various cannabinoids, particularly CBD as well. The migraine as a condition is one of the more common conditions that people self-report relief from the use of cannabinoids. And the challenge here again is, if you were to get in a position of recommending for someone to consider this, we just don't know specifics of dosage. Is dosage based on weight? Is it based on gender? These are the areas that we need more information on, but anecdotally, we are hearing from patients and others that yes, they're getting relief for migraines by use of cannabinoids. Now, I will say one thing, that despite the lack of research of those specifics, there's also a limited amount of adverse serious concerns. There certainly are, they do exist. There's a fair amount of studies that look at long-term concerns relative to more so THC, but the non-THC based cannabinoids, for the most part, excluding what we don't know right now about the current use of, for example, Delta-8 THC, for the most part, we don't see long-term or even short-term adverse events from the use of a non-euphoric cannabinoid relative to any of those in even high dosages. And I think that's why some folks are recommending significantly high amounts of CBD, which I'm not a big fan of, but again, there's really no evidence in one way or the other yet to say that's right or wrong.
Great, thank you. So we're kind of curious, have you had any problems, or what should folks be aware of if they're trying to get funding to do this type of research, or even to get IRB approval? What have been your experiences or concerns?
Great question. Similar to how I had to educate myself and I try to educate others, there's a large component of educating your own institutional review board. And if you think about it, it's not likely there's an expert in this area. And so even though their job overall as a group is to assure safety in your proposed study, they don't necessarily have the expertise to judge product you're using, dosage you're using, administering. And so I think I would recommend highly that the first conversation you have on campus is to include members of your IRB. Give them a heads up that this is an area that you're interested in studying. And I think work slowly. So from our end, for example, we started with surveys on the topic, no problem. They got a feel that this was an area we were going to start studying. Then we talked to them more about dosing and application and potential adverse effects and risks, of course, which they're most concerned with. So once you develop a comfort level with your IRB and they have a good understanding, you also can put a stronger proposal forward knowing what they're looking at. And so I would encourage anyone that wants to study in this area to take that approach first and foremost. Simultaneously, work with your administration, because it's helpful to have administrative support, and particularly from your grant office, who can help you craft pre-proposals in this area. And the stronger support you have, the greater opportunities that individuals will help you find funding that exists. There is funding in this area, like all other things we look at. It's competitive. There's also funding with industry. So one thing to think about is to look away from the traditional grant application process. There are literally thousands of cannabis companies that exist. It's the fastest growing industry in the world. And a large number of these companies obviously produce their own product and distribute it. But all their studies on their product are done in-house. And so while they can tell you how good their product is, they don't have an independent third party who is able to verify that and then test it and then publish this. And so there may be an opportunity to partner with industry and receive grants to help, to not help, but I should say to validate and look at the efficacy of that particular product. And now you get into the specifics of not just a product per se, but the ingredients of it. So are you going to study CBD or CBN, et cetera? So it's kind of like anything else. If you're a researcher, you need to put a strategic plan together. This one just requires a significantly additional level of educating and support gaining from your institution, because let's face it, it's been a taboo topic for a long time, and we're undergoing a cultural shift. And so you can either be part of the cultural shift, or you can sit back and let others lead the way and jump in afterwards.
All right, so this is a really interesting question. So we've all heard of sort of the phenomena of runner's high. Is that, managed by the endocannabinoid system? Is there a relationship there?
Great question. When I went to school, we were taught all about the endorphins and enkephalins. And when you hit mile 12 in a road race, you feel great and you get this runner's high, right? I don't know anything about that. I've never hit mile 12 myself running, so I can't speak to what that feels like. But there's now theory that it's the actual endocannabinoid system in the body that's responsible for facilitating, when you get to this point, it's not the enkephalins and endorphins, it's the endocannabinoids that are being released. And therefore, that's how you're feeling that sort of that better sensation, if you will, for lack of better terms. Now, what's of real interest is there's a book that's out there called Runner's High. It's written by an author named Josiah Hesse out of Colorado. And what he explained was that he never was a runner in his life. But when he learned about this, he's an investigative writer. When he learned about this, he decided to experiment with it. And what he actually did was he started using low doses of particularly THC prior to running, saying that if in fact the cannabinoids, in general the endo, but if you supplement it with the phytos, the THC, if you find that they're responsible for that euphoric feeling after mile 9, 10, 11, 12, why not take them before you start running and feel great from the start? And he lays his case out in this book, and it's really, really fascinating. It's, it's the farthest thing from peer-reviewed science, but it's a really good book to read to give us a jump start to better understand, for those of you that are, bench scientists, clinical scientists, exercise physiologists, that want to take a closer look at this and get involved in this area of research. I think this is groundbreaking, and there's certainly hypothetical strengths to believe that the ECS is responsible for the runner's high.
That's really interesting, Jeff. You mentioned earlier that about, I think you said around 23% of college athletes had used in the previous month. Do you have any data, or is there any data out there about the reasons why they're using this as their sort of treatment as choice? And is this kind of use likely to affect other things, sleep performance, school performance, things like that?
Yeah, so one of the studies we're writing up right now is actually a survey that will ask student athletes not only their use patterns, but for particularly what reason they're using forms of cannabis. And we've been getting good responses so far in the surveys that we're doing, because I think athletes in general really want to see all of the testing go away. Many student athletes now live in a state where forms of cannabis are completely legal, but they play in a team, and so they're breaking a team rule where they have to be careful for NCAA testing. They understand cycles of testing. Sometimes it can come unexpected, but for the most part, they understand how to work around this, and they're finding relief from what they take individually. There really isn't a consensus across the board. People will tell you that they're taking something and some amount of it for various different reasons. What I'm hearing the most of from the student athletes are anxiety, pain, and sleep. Although, ironically, CBD is believed to also be or to have anti-inflammatory properties, and so that's something that we would want to study more relative to this. But I think we're seeing more and more individuals use this. They have to be careful because theoretically they can be drug tested, and there are consequences for that, regardless of whether it's legal in their state. They've agreed to sign up for a team within an organization, and so they're obviously subject to those guidelines. I'm sorry, what was part 2 of that question?
Yeah, I think you touched on it. It was just, wondering whether sort of use for sport performance, by these athletes or for pain or anxiety may have effects on other things like sleep or school performance. So I think you did touch on that.
Yeah, you mentioned school. We're looking at that as well. We're looking at studying the general student body over a 21-day period of using a specific cannabinoid in the evening, and then reporting in the morning about their sleep patterns and their focus and concentration. Not necessarily the outcome of their grades. There's too many other variables involved with that, but are they sleeping better? Are they focusing better over a 21-day period?
Great. And Jeff, you mentioned that, of course, it's really important for an athlete to know what the rules are. It may be something maybe legal in their state, but if they're on a team, it's a do not do. So what are some resources that people should be aware of? Like, where can they find out, more about, using, let's say, CBD oil, and how much can you use, and is it eligible for use on your high school track team, even though, it says certain things aren't eligible? Like, where should they look to find out more information about rules?
This is a great question. So I think, first of all, it is arguably one of the most difficult things to do is when you just sit down on your computer and click on something to know what's real and what's not real, and what's good information and what's bad information. So certainly for starters, any governmental website will be factual. So anything related to FDA or CDC that speaks to the facts of various types of cannabis will be helpful. State law and one's practice act, if you practice under any form of regulation, are critical, because just like a lot of other things that we do, we have a scope of practice that can be different depending on which state you live in. Through the NATA, our task force just recently completed a series of educational documents that we hope will very soon be posted for members and others to have access to learn about cannabis. And I think you're going to see over the course of time, ACSM and other organizations do a similar information dump so that its members can have a factual location to turn to. These are not position statements, they're not endorsements, but they provide valuable practical tips. So for example, if you're working with a sport team, this goes well beyond just recommending and answering questions about benefit and risk for a cannabis product. This is, for example, you might be traveling with team and holding on to somebody's EpiPen or inhaler. Well, can you hold on to their CBD? What about if you cross state lines or country lines? How will TSA view what you're taking with you when you leave the United States and go into Canada or Germany or Italy? So information like this is helpful. We try to provide some of that through our task force work with the NATA. And I think these are the real on the ground, in the trenches questions that individuals will have as we see more and more cannabis use work its way into our athletes and our patients.
Okay, we have time for 2 more questions. One is very quick. Someone was asking if you could repeat the name of the book that you mentioned, the Runner's High book.
Yes, and I received no royalties from this, but it's called The Runner's High, and the author is Josiah, Josiah Hesse, Hesse. Now, in full disclosure, I was interviewed for part of his research in the book, and he writes about that, but that's actually what tempted me to read the entire book. And again, to me, it's fascinating because he speaks in a manner that combines what patients want to know and what we should know. And it sort of forces my hand, for example, to study more, to be careful in what I advise and how I educate, but to better understand that something is happening. There's a movement. Something is happening here. And despite the lack of strong scientific evidence, there's an awful lot of N's of one all over. And these are people who are swearing by benefits of some form of cannabis that they use. And so the author lays it out nicely in the story that he tells. And I think it will trigger your interest, like it triggered mine, if you read that.
Awesome. Okay, one last question. So you mentioned there was some drug interactions potentially with cannabis use. If a person listening is a personal trainer working with clients, or somebody who's working with athletes who might be using cannabis products, what should they know? What are 2 or 3 things? I would imagine, what other medications they might be taking. That would be important to know. Are there other things that they should be sure and ask when they start working with the individual?
Yeah, this is a great question. This is so unique because in most other things that we do where you apply a topical or you advise someone to go to GNC and grab a product, we don't necessarily talk about everything from the physiology of the body and how that product is utilized and how it interacts with other substances. And here we're talking about something in even this presentation here in a short time, we're talking about where it starts out of the ground as a plant all the way to its application. So where do you begin? I think the first thing is to develop a team of individuals who understand cannabis. So it could be a pharmacist, it could be a physician, individuals who you can pick up the phone with or text or email, refer patients to, whatever it might be, so that you can learn from them over time and you can better understand when to refer individuals versus when you can advise, recommend, or share educational information. The second part of that is if you're specifically, as you mentioned, a personal fitness trainer or anyone else where you're working as a business in a contractual phase, I would probably want to have somebody review forms that I have from a legal perspective so that you are careful to the type of advice you give. You're certainly not going to recommend someone to go get a cannabis product unless you protected yourself appropriately, because there are still so many unknowns that go along with this. And it's a very strange situation because I can walk up and down the street of my neighborhood and every person will be using some form of cannabis, but because I have a license, the minute I start to talk to them about this, I'm held liable for what I say and what I share. So I think the keys are to know enough information about answering your questions. What's the difference between the different cannabinoids? How do they work in the body? What are they proposed to do? Because as you start to learn this, you're going to find that there's a disconnect. Someone's taking a form of a cannabis, but the condition they have doesn't match what this cannabinoid is proposed to do. So they might even come back to you and say, well, I tried this and it doesn't work. And it won't work. And that's like, saying that you're taking a certain vitamin for a condition that's not designed to work within the body. And so start slow, just like we talked about the dosage with your education. Start slow. Learn a little bit. That's exactly how I started. I took some online courses. I quite frankly learned some are good, some are not so good. I went to some conferences. Some are good, some are not so good. And it's a learning curve. And you just need to learn enough to know within your scope, how you can help the patients, and then like everything else, when it's time to refer. So build a good team around you that can work together.
Thank you, Jeff. This has been awesome. I mean, fascinating and just so timely. So thank you so much for your time today. Unfortunately, we didn't get to all the questions, so we'll have to see if we can twist Dr. Konin's arm to maybe visit us again at some point. As a final reminder, if you purchase a CEC for today's webinar, that will be applied to your ACSM account within 2 weeks. And then at that time, you'll also get instructions within an email about how to access the CEC. Everyone will get a recording, a URL to a recorded version of today's talk. And we apologize for the technical glitches, but we'll be able to chop that out of the recorded version, so you all will be able to participate in watching this again. I know several of you were asking about a recording in the chat, so we will be doing that. And we'll just remind folks that we are going to resume our brown bag series next month. For those of you who are students, good luck on your final exams. For the rest of you, ACSM wants to wish you a wonderful holiday. And we put a little slide at the end just to remind folks that we may have Jeff slide to his, there we go. Just to remind folks that if you're not an ACSM member, to check us out at acsm.org. And with that, we'll say thanks again to all of you for participating this year in the Brown Bag Series, and thanks again to Dr. Konin for a wonderful presentation today. We'll see you in 2022.